Ready for Chapter 8?
Chapter 8.
Okay, Chapter 8 is lifting and moving patients. In the course of any typical EMS call, you're going to have to lift and move patients a couple of times to get them where they're going. You're going to have to move them from wherever they're at when you get there to your stretcher, and from the stretcher, or not from the stretcher, but on the stretcher into the back of the ambulance, and from the back of the ambulance into the hospital, and from the hospital onto the bed. So we have at least 4 moves just there. If you have a patient who is somewhere where you can't get the stretcher to, there are other moves that you may have to use as well. If you have a patient who is in danger, you're going to have, or you could have to use an emergency move to get them out of danger. So lifting and moving a patient is something that you're going to do pretty much anytime you see a patient. Now, if your patient refuses, you may not have to do any lifting and moving, but how much does refusal make up your care? Like how many times does a patient refuse?
1 out of 20.
Good. That's a guess, but that's a good guess. We don't deal much with patient refusal, do we? No. So, when we talk about lifting and moving patients, we're talking about the process by which your patient makes it from wherever they were at when the call started to the hospital. So, when we do that, we have a couple of different types of equipment that we use. What is some of the equipment?
Backboard. Straps.
Stretcher, what?
Straps.
Okay.
C-collar.
Okay, collar.
Stair chair.
KED is actually the name brand, okay? It means Kendrick Extrication Device, but it's synonymous with whatever best type of mobilization device you want to use. It is a name brand, but we use it to describe any of those best type of mobilization devices.
Like Q-tip.
Pardon?
Like Q-tip.
Like Q-tip, yeah, or like Kleenex. Okay, what other types of equipment do we have?
Orthopedic litter. Scoop stretcher.
Short backboard. Blanket.
Blanket.
Their clothes.
Okay. Now we're thinking outside the box. Can we come up with any other ones?
Yourself.
Pardon?
Yourself.
Yeah, yourself. Or in my case, the firefighters. Sorry. What else?
Blanket. Yeah, blankets for the ladders.
We could use ladders.
Oh yeah, the basic litter.
Ropes.
Good.
Ladder truck or other crane-like device.
Anything else? If we sat here and thought about it for a while, I'm sure that we could come up with other things. So we talked about straps. I mean, we have in this classroom, we have 3 different types of straps, right? We've got spider straps, we've got buckle clips, and we have tape. Does tape work for straps? Yeah. So all of these are pieces of equipment that we might use when we need to move our patient. Is there an appropriate time and an appropriate place to use each of these?
Of course.
Of course.
Proper tool, proper job.
Yeah. What a dumb question, Susan. Of course there's an appropriate time and an appropriate place to use each of these. Is there also an appropriate time and appropriate place to not use any of them?
Yes.
When?
Emergency situation.
In an emergency situation when we got to get our patient out. Right? When we're considering whether or not we should be caring for our patient and what equipment we are using, what is our most important consideration?
Safety of ourselves.
Rescuer safety first. What is the next most important consideration?
Safety of others.
Okay?
Like other us.
Other personnel?
Yeah.
Other us? Safety of other us?
Yep.
That's good. All right.
Safety of other bystanders.
Okay. And at some point we get to the safety of our patient too. Right? Way down on our list of people that we're responsible for. Some of these are appropriate for some patients and some of them are not. So it is your responsibility as the rescuer, as the person providing patient care, to figure out which is which, when it's appropriate and when it's not. Okay, let's talk a little bit about the stretchers. Most ambulance stretchers, or most stretchers, they are what is most commonly used to move or carry a patient, because they're designed to carry someone who weighs up to 500 pounds or 350 pounds, but bariatric stretchers are designed to carry people up to 750 or 800 pounds, right? And when you get the patient lifted on there, they try to design them so that they roll fairly easily. Okay? So the stretcher is the most common used item to transport patients or move patients. The stretcher is used in combination with almost all of the rest of these. Okay? Your stretcher is used to get your patient from wherever you can get them on the stretcher at to the ambulance. All of the rest of these are used to get your patient to the stretcher. Right? So when we use a backboard, do we use it independently? We did in class today, right? But we don't when we're dealing with a patient. Do we use the straps independently?
Maybe.
Maybe?
Yeah.
How are we going to use them independently?
If you were doing the backpack carry that you said, they tied their wrists together.
Yeah.
It's just the strap.
Yeah, or you could, the carry that you said you liked, you could just use the strap, or you've used the one where you wrap the patient's hand together and then put it over
for drag.
togethers. I caught it, yeah. You wrap their hands together and put it over your neck and drag them out. You could use a strap for that. What about the one where you drag them out by their arms?
Yep.
Yeah, you could use the straps independently. Are you going to take them all the way to the hospital?
No.
No. Where are you going to put them?
On the stretcher.
On the stretcher. Okay. Can you think of any of these that you might use independent of the stretcher? I might use it. No, I'm not even using firefighters independent of the stretcher. If they're putting my patient on the stretcher on their backboard, they can do the lifting on the stretcher too. What were you thinking, Corey?
Well, they ended up on the stretcher.
They ended up on the stretcher.
It was in the
Even if they climb in the back of the ambulance themselves, where do they sit?
on the stretcher.
On the stretcher.
I was thinking the life flight, but there's a stretcher in the life flight.
There's a stretcher on life flight, yep. Okay,
Well, every time you put a patient on board your ambulance, regardless of where they're at, they're supposed to be belted down. So yeah, straps do play an integral part. And you always end up putting the person on the stretcher and putting straps on them there because that is their seatbelt.
yeah.
They may not get transported. If they're not transported, you take them and then they refuse transport. They might not necessarily end up on the stretcher.
Yes, if you take them and they refuse transport, they may not end up on the stretcher.
Like you're getting them out of somewhere.
That is possible. Okay. What are backboards made of?
Plastic.
Or wood.
plastic or wood, okay, some kind of
Metal.
rigid material that's kind of tough because you can pick people up on it. And I went out to Canyon County Paramedics, this is several years ago now, and the fire department, Caldwell Fire Department, had taken one of Canyon County Paramedics' backboards, one of the long ridged boards, not like the one that I showed you guys earlier that curves up, but just one of the long flat ones. And they needed a short board to get to a patient, and Canyon County Paramedics didn't have a short board on, so they just sawed right through it. So then they had 2 halves of a long board there. It was kind of cool. Backboards are usually 6 to 7 feet long, and they're usually used for patients who are found lying down. Either lying down on their face, which is what position?
Prone.
Prone, good. Or lying down on their back, which is?
Supine.
Supine, good. Prone and supine. Okay. Newer backboards are made of a lighter plastic material, and they don't absorb blood or other infectious substances, so you don't have to worry as much about cleaning them. But if you are with an agency that still uses the old wooden backboards, make sure that you're taking the appropriate infection precautions before you reuse them. When you move your patient, you have to make sure that injury doesn't happen to you, to your team, or to your patient. Practicing lifting and moving, it's a technical skill and it requires repeated training and practice. And many EMTs are injured while lifting and moving patients because they don't use proper body mechanics. So we're going to talk about body mechanics. And since you guys all work together at a fire station, you can practice lifting and moving. I'm assuming that you already do that anyway. Practice lifting and moving with each other. Okay. What is this? What is this right here? Let's drag Mr. Godet over here into the front of the camera.
You indicated the collarbone or the clavicle.
Clavicle.
The clavicles right here, okay? And what are these? These bones back here?
Scapula.
Scapula. Together, the clavicle and scapula make the shoulder girdle. When you lift something, the weight is transferred through your arms to the shoulder girdle and then down the vertebrae. Okay? The vertebrae, when you are lifting correctly and you're standing upright, the vertebrae are stacked on top of each other. And they're designed to be used this way. All of your muscles that connect to your vertebrae, your costovertebral joints, all of these are designed so that your back is nice and straight and strong. So it's designed for you to lift with your back straight. Okay? He doesn't bend over, but if you can imagine him bending over and exposing his lower back, it's no longer nice and straight and strong. They're not stacked on top of each other. So if you don't lift correctly, you can damage your back, and not just the muscles and the ligaments and the tendons around your back, but you can cause serious damage to the discs that exist between your vertebrae. Okay? So when we lift with our arms, and lifting with our arms transfers our weight into our shoulder girdle. Our shoulder girdle transfers the weight down into our vertebrae, and our vertebrae transfer the weight into our pelvis, into the pelvic girdle. All of our lifting, now the strength for our lifting, if we're doing it correctly, comes from our butt and our legs, right? That's the muscles. Those are the muscles that help you with your lift, but where the weight is being held at is actually being held in the bones. Does that make sense? Okay, so when we lift our patients, we need to make sure that we're lifting appropriately. Body mechanics is the relationship between the body's anatomic structures and the physical forces that are associated with lifting, moving, and carrying. Plain English that for me.
Say it again.
Make that plain English. Take it from the definition that's in the book and put it in plain English for me. the relationship between the body's anatomic structures and the physical forces associated with lifting, moving, and carrying.
Using your body as a machine?
Okay, using your body as a machine.
And the tactics of that are to keep the load as close to your center mass as possible using your strongest musculature to do the lifting and keep the weight from being out and off balance.
If you use good body mechanics when you're lifting and moving, it reduces the risk of injury. Remember that our weight, whatever it is we're lifting, transfers through our arms, to our shoulder girdle, through our vertebrae, into our pelvis. It doesn't take as much strength to hold something close to you in the appropriate form as it does to hold something close to you even if you're not in the appropriate form. I can tell you, just standing here right now, that standing like this with everything near me, my back doesn't hurt as much as it does if I do this. And you can feel the difference. Stand up for a minute. If you just hold your arms close to yourself right here, okay? Just in your normal standing position, just hold your arms close to yourself. Is there a lot of pain? I mean, maybe you guys have a lot of pain, I don't know. But it feels okay to me, right? As soon as I lean forward at my waist, I can feel
Feel the stresses.
the stress in my lower back. Now, that's just me. I'm just holding myself right now. I'm just holding my own arms. If I'm going to lift something, if I'm going to move my arms out and lift something, how do you think that stress is going to translate to my body?
Not well.
Not well. If I have to squat down, so when I'm like this, I'm what, 5 inches lower or something, maybe to reach something?
Yeah, but you're out here, whereas if you were to get closer to it and descend
Squat.
5 inches, you're in that no stress condition.
You're in that no stress position, and it doesn't bother my back anywhere near as much as this position does. Can you feel the difference just that 5 inches makes? Okay, can you feel the difference?
I can.
Can you?
Yeah. Why wouldn't I be able to?
Well, I don't know, you just aren't like, yeah, I can tell. So I'm just making sure that I'm making sense to you too.
Yeah. I can tell.
Better, good job.
It's hard with gym rats.
All right, let's talk about good lifting mechanics. Lifting mechanics. Okay, at the most, you should spread your feet about 15 inches apart. For most of us, that's going to be about shoulder width. That looks like about 15 inches, right? Some of us have bigger shoulders than others. Does that mean that they should spread their legs further?
Maybe.
Yeah, maybe.
Depends on their comfort level.
Yes.
Depends on their comfort level and depends on their center of gravity, right? A person who is taller has a slightly higher center of gravity than a person who is shorter. So depending on where they're comfortable at, they may want to spread their legs out a little bit more. Maybe they can get lower with their legs spread out a little bit. Make sure you place your feet so your center of gravity is properly balanced. Where's your center of gravity at?
Somewhere between your spine and your navel.
Somewhere between your spine and your navel? Is it in your hips?
It's different for everyone.
It's different for everyone, but you can kind of figure that your center of gravity is usually right about here. Maybe a little bit higher, depending on your size, maybe a little bit lower, depending on your size, and where you carry your weight. Someone who's more muscular up top and less muscular on the bottom, where's their center of gravity going to be?
Up top,
It's
higher.
going to be a little higher, right? So where they carry their weight, where they carry their muscle, where they carry their fat, all of that is going to affect where their center of gravity is. So my center of gravity is not the same as any of you guys' center of gravity. And you're the only one who can determine where your center of gravity is. But you should place your feet so that your center of gravity is appropriately balanced.
I lost my manual. I don't know.
With your back straight, you should lower yourself down into your lifting position. Okay? For some of us, that's easier said than for others. When we were talking earlier about powerlifting and power gripping, it's better for me when I'm lifting if I can keep my feet flat on the ground. Can you see me? It's better for me if I can keep my feet flat on the ground. Well, guess what? In my current shape and condition, I can't. So if you look at the way my feet are set right now, I'm on the inside of my feet instead of flat. That's okay, they don't need to see me. So when I lift, I need to make sure that I lift and as quickly as I can get myself back to flat-footed. Because lifting from this position with my feet curved in, that's not a strong lifting position. It's not a strong lifting position for me. Is it a strong lifting position for you?
No, it's bad
No.
for your knees.
Yeah,
Buckle in.
yeah. I know I'm weak. That's why firemen are so important. Firefighters are so important. I know I'm weak. Lift the patient by raising your upper body and arms and straightening your legs until you're in a standing position. Lift the patient by raising your upper body and arms and straightening your legs until you're in a standing position. Oh, I kind of did that already, right? Already did that step, okay? We did practice the power lift earlier when we were together, right? I did notice that some of us, myself included, have a tendency to stick our butt out when we're trying to lift and use our legs. I have a hard time with that. I lift like this. And I shouldn't, because I can feel the difference. I can feel the difference even without trying to lift a person. I know better, and yet I still catch myself sometimes when I'm lifting, trying to do it without doing it appropriately, and it hurts. Don't do it. It's dangerous for your back. What is a power grip? We talked about this during our skills earlier, but what's the power grip?
Underhand.
Underhand? What else?
Thumbs out.
Thumbs out.
10 inches apart.
Underhand, thumbs out. What else?
10 inches apart.
10 inches apart. And all of your fingers should be at the same angle. Okay? What about reaching and pulling?
The further you reach, the farther off center it puts you. Probably better to push than it is to pull if you have the choice, because you can use your bigger muscles to push as opposed to pulling, which is something you're not naturally set to do.
And if you have to pull,
Pull in a straight line. Don't pull in like twisting your back.
yeah, don't twist your back. And try and get within about 15 to 20 inches of the person that you're pulling, right? If you can get that close and pull in short movements, back up, pull again, back up, pull again.
You're more in a standing stance instead of a leaning stance.
Yep, you're not leaning. This position to pull isn't as safe as pulling from 15 to 20 inches away from you. If you go more than about 20 inches, you're off center again. And off center is not a good place for you to be when you're trying to move your patient. You should, let's see, principles of safe lifting and carrying. You should estimate your patient's weight before you lift them up. Okay, 2 EMTs should safely be able to lift up to 220 pounds. If your patient is more than 220 pounds, you should ask for help. Two EMTs can safely lift less than, I wrote 200, but should be 220, okay? If you have the personnel, use more than 2. Remember when we were talking out here earlier and we were talking about the difference between a one-handed carry with 4 people or 4-corner carry and a diamond carry? That's all about positioning your resources. It's all about knowing what resources you have and putting them in the right spot to be the greatest asset to you and to your patient. Yeah? That's an important thing to remember, an important thing to do. If you have a patient who weighs more than 250 pounds, do not attempt to lift them with less than 4 providers. Why?
Too much divided by 2 people. Somebody stands to get hurt, you need more resources.
Not only does somebody stand to get hurt, one of the EMTs, but you also run the risk of hurting your patient,
That's it.
right? We don't want to do that. We don't want to hurt our patient. That's not our goal. The other thing you need to remember is to know the weight limitations of your equipment. Spend some time playing with your equipment. Make sure you know how to use it. The stretchers that I have here in my classroom, I have one yellow stretcher, which I can't remember the brand name of now, but I have 2 of the old silver old stretchers, right? I've got one in my ambulance and I've got one in that back room over there. They're a pain in the arse to use. They're horrible. They're just hard to use. Even the yellow one, which is a nice stretcher, isn't as current as some of the other stretchers that are out there. So it's not the easiest thing to use either, because it's not the same as what I'm using in the field. So teaching my students how to use it requires a little bit of education on my part to become familiar enough with the stretcher that I can show them how to use it. Luckily, we're in a classroom. We have time to educate ourselves on the equipment. We're not in the field where we don't know what's going on. How often do you guys go to your EMS transport agency and spend time playing with their stretcher?
Never.
Not
Never.
yet.
They came out once.
Yeah, they've come out a couple times, but
Might be something you want to talk to them about when your working relationship is a little better. Even if it's not Elmore County, they're EAS, right? Elmore Ambulance Service. Even if the transport agency that you're working with is Ada County, because sometimes you work with Ada County, right?
Most often we do.
Most often you work with Ada? Okay, good.
Elmore's the exception.
So if your transport agency is Ada County is probably really willing to come out and show you their equipment and teach you about it. They're usually pretty good about that outreach. They like to come here and talk to my students too, you know. But they'd be willing to show you how to use their equipment. One of the stretchers in the back of our ambulance at work is a power stretcher. So you put the back of the stretcher in the back of the ambulance, you lift up on the end and push the button and the bottom raises right up. You slide it in. It's a nice stretcher. Not all of the stretchers that we have in our ambulances are like that, but that one is a nice stretcher. And it's usually reserved for when we They usually put it on a shift with 2 of the weaker people. The one that I have in there is not a power stretcher. That's all right. Students can still learn to lift and move with it. Where if you're carrying a patient on a backboard, I'm going to draw a picture of a backboard and you guys are going to laugh because you're going to think it looks like a casket. Okay, you're carrying a patient on a backboard. I could put little fangs on him and then it would really look like a casket, right? You're carrying a patient on a backboard. Where's the weight of that patient at?
Right half, head half, torso half.
The head half. There's a lot of weight from the butt to the head. Why is that important to know or important to remember?
Put your stronger guys up there, because they're gonna be lifting more weight.
We're going to put our stronger guys up here because they're lifting more weight. What is the diamond carry?
1 on the head, 1 on the foot, and then
2 on either side.
2 on the hips.
What good does a diamond carry do us?
3 people at the heavy part.
3 people at the heavy part. Hey, what about a one-handed carry or a 4-person carry? What's the
2.
difference between a diamond carry and a 4-person carry?
2 at the feet, 2 at the head.
You don't get quite the stability.
You don't get quite the stability.
Weight distribution isn't as good. The people on the feet are basically carrying nothing.
People at the feet are